Back down here from iAfrican on the sidelines of the Deep Learning Indaba 2025, live from Rwanda. Rwanda is such a beautiful country. Shout out to all the Rwandans for hosting us. Your food is awesome. Your cities are clean. Your streets are clean. You guys are wonderful. And one of the, I think, well-attended workshops that happened today at the Indaba was the AI and health workshop. So there were, I think, 4 or 5 workshops. We had robotics, you had AI in health, AI in climate, AI for business, and I forgot what the last one was. Forgive me. But we also had, notably, the AI in health. Now, we have one of the panelists that was on the AI in health, and that is Dr. Tobi. Dr. Tobi, how are you?
I'm doing okay.
Thank you so much for joining us. Dr. Tobi, your story is actually quite interesting, and we're going to go into that. Now, let's start from the beginning. Dr. Tobi, you are a physician in one of West Africa's busiest hospitals. That experience with patients, there's a lot going on, paperwork, overloading of systems. What influenced you to pivot to AI?
Yeah, long journey, but short story, short version is there's so much that's broken in healthcare.
Mm-hmm.
Just like you said, working in a hospital, you see how things are, but you also are able to visualize how things could be. And just the amount of time we spend seeing patients, the number of patients that come in every day. And one of the things that really, really struck me was if you're seeing 40, 50 patients a day, maybe at patient 1, 2, 3, 4, 5, your head is still working right. Patient 9, 10, you're still doing your best work. By the time you get to patient 39, patient 40, 41,
You're tired.
Yeah, your brain is just roasted. You're thinking about your family at
100%.
home, your dinner and all that. And so that's the place, that's the time that you start to need something else that's supporting you.
100%.
That's helping you make your, that's checking your decisions. If you wrote 500 or 5,000 or 50, that can check and say, hey, double check this, or you measure something. And so there's just many opportunities like that where technology can help make healthcare cleaner, better, particularly for doctors that are seeing a ton of patients.
100%. Dr. Tobi, healthcare is such a sensitive issue on the continent. We've got challenges in South Africa. There's challenges everywhere, to be honest. And healthcare is an essential. Now, when you talk about AI tools, when you talk about the ability to sort of have an assistant or the ability to have that technology tool, what exactly are you talking about?
So there's many types of tools that doctors can have. For example, your private clinic, and you need help with your billing. So patients come in, how do they get payment? How do they book their next appointment? For example, you don't want to be spending your time thinking about things like that. There's simple stuff that can help you do things like that. There's more advanced things like following up patients. So you have a patient that's supposed to take their medications every 2 days and if they miss a dose, it's a big problem. So you need tools that help connect you to them, remind them, make sure that they come for their next clinic visits and things like that. And then there's more advanced stuff like for diagnostics. You see a patient, you're not certain what's going on. You need a second opinion. You need extra help. Then you have like some AI tools that can come in there and say, think about this, suggest things this way. One thing that we're working on is voice tools.
Yes.
So
speech to text.
Yep.
100%. Intron Health. Let's go deeper. What is Intron Health? What is speech to text? And in the context of healthcare, what does that look like? Walk me through it.
Yeah, so there's many ways to use speech in healthcare, but the specific one we are doing is the one that helps with workflows. So think about a doctor that's seeing 50 patients a day and a hospital that's just had the huge digital transformation. They moved everyone from paper to an electronic system. They have laptops, they have internet, they have whatever. They invested millions into going digital. But someone promised them that with this system, you have better decisions, better data, everything's going to be great. But everyone forgot that for the system to run, someone has to enter that data. So people have to put in data so you can get some output from it. And the person that's going to do that data is the same person who's already seen 50 patients a day.
Okay.
And so you have a doctor that has a heavy workload already, and you say, okay, here is a laptop. make sure you type down notes for each of these patients. So I'm saying 50 patients. It means I will likely be typing 50 pages of notes every single
day.
and like nobody's going to do that.
Chaotic.
Yeah,
That
nobody's
gets
going to do that.
extremely chaotic.
And so many of them either just dump the software, or if they do, they just give you one line or two lines and just say
it's not
patient
descriptive enough.
Yeah.
It's
So
not
you see,
descriptive enough.
someone told us, you had a 30-minute conversation with this patient. We saw the patient go. You talked with them, and then they come out and you just write
2 lines.
2 lines. And so the lab is figuring out why you did prescribe this test, this medication, and they don't have any explanation anywhere.
100%.
And so that's where, instead of spending 1 minute, even if you're spending 1 minute to type, we just did a study that shows that the speed on the keyboard on average across Africa is about 20 words per minute for doctors.
Okay.
20 words. So that's just like one line.
That's just like 1 line.
2
And
lines
it's still a task. It's a huge task to speak. It's a lot of work. It's a lot of work.
But with voice, in 1 minute, the same doctor is able to do 90 to 100 words just by speaking. And so just imagine you're going from a 20-word document to a 100-word document on average per patient. You can see how that transforms the entire quality of data you have.
Okay.
Not just quality, the quantity you get as well, because now that they have access to voice, they don't need to think about, okay, how do I write everything that just happened? You can just speak. It's just natural. It's more convenient. And so for systems that are trying to go from paper to electronic, this is like a key thing they need to do to make sure that transition is actually successful.
So, Dr. Tobi, I'm a visual guy. So let's just break it down. I'm a doctor. I'm in theater, or I'm in my patient room. The Intron Health app, is it an app? Is it a platform? Like, how do I walk me through physically?
Okay, great. Yeah. So there's multiple use cases. The simplest one is you have a patient sitting
Right
across
next
from
to
you.
me. I'm the patient.
Yep. So we have a microphone device,
Like a dictaphone type of thing.
a desk mic,
Okay.
or even in the most basic case, it could be of mobile phone or a laptop. Any device that can record.
Okay.
So it just takes audio as we're talking, and it's transcribing that in the background. So as you talk, I ask you, do you have a headache? You say yes. When did this start? It started 2 weeks ago. So all that talking we do for like 15 minutes.
Okay.
The system captures that.
Okay.
And before the visit ends, it's able to draft your clinical notes for you. So
Wow.
all the stuff you were going to go sit and like write down or type, it drafts that for you, and you can just review and edit. So that's the cool new features that we did this year. The other basic use case is, okay, you've seen your patient, they're done. You ask them to leave. Maybe you've written their prescription. They step out. Once they step out, you pick up your laptop, open your laptop or your phone, and just record. Oh, I just saw this 50-year-old man who came in with headache, fever, and all that. And you just run through your notes verbally. So the same time you will have spent doing all this, you just talk through that note, and it just transcribes that verbatim for you. Maybe add some structure, punctuation for you. Our system does that, and then you have a decent note, and you can just submit that. So that takes a lot of the stress of doing those, whether you're a surgeon or a psychiatrist. That taking all that work away from you and just letting you go to the next patient. Yeah.
Dr. Tobi, this is critical because files go missing all the time. All the time. And files are so analog.
Yeah.
Why do we still have files in hospitals, you know? But I want us to go to the business aspect. So in terms of adoption, subscribers, okay, let's before we go to the patient side, let's go to the doctors, the medical practitioners. How your adoption with, doctors and medical practitioners, how is it? How many people are currently using Intro Health? And what are the numbers looking like? What regions are people currently using it in?
Yeah, so we're currently in 6 countries:
Okay.
Nigeria, Kenya, Ghana, Rwanda, Uganda, and South Africa, so a little bit.
Okay.
And so you have 2 types of users. You have the guys that are like, wow, this is fantastic. I use this every day now. It just saves me a lot of time. It cuts down my documentation time by 3 or 4 times, or it just takes like a lot of cognitive load off me. So there's those guys. There's the other guys that are like, how will I mean, I'm so used to typing when I'm
I call them traditional doctors.
So what they do is that you're talking to the patient, and while the patient is right there, you're typing, you're like, okay, yes, what do you say? Yes. And so they're like, I'm already doing my typing in the, like, while I'm seeing my patient. Why will I do something differently? How is this faster? And all that. So there's people who don't really understand that typing they're doing well. Because what happens is that they ask a question and then the patient answers and then they type. The patient is actually sitting and watching. So that's like 2-3 minutes gone.
Of course.
And they're like, and then they continue the conversation. And so that makes the conversation much longer. But yeah, there's folks like that don't really understand how technology should work or find it difficult to visualize. And so we have a really interesting bunch of users across many countries, across even within countries, people that respond differently.
I just want to know a little bit more about the demographics. Is it mostly younger medical practitioners that are adopting it? Is it rural, urban? Can you just paint that picture for us?
Great. So one rule of thumb for healthcare, I usually say, go to it's usually best to deploy your solution where you have the most support. You have early adopters. So usually it will be urban hospitals right now where there's internet, at least, and we're not like
connectivity strong.
So at least start there. You can 100%. Then maybe later go rural, but at least start there. 1, 2. Younger people definitely are more eager because they are more used to using Facebook, TikTok, whatever. So there's a higher chance that they would adopt first. However, we're seeing the older folks, because they are the ones that struggle more with the keyboard. So there's actually now a separate group of older people who are like more likely
embracing
to,
it because you just talk and then
they're like,
records everything.
I can't type at all. So
wow, Dr. Tobi, this is actually amazing. Now, besides administrative functions, this is now note taking, speech to text and typing out the prescription or the case may be. Are we seeing it speed up the process of healthcare? Does a doctor see more patients? Walk us through that aspect. Like, what does it help facilitate better?
Great. So I'll say 2 things. The first one is, what's the effect of notes that's done faster? So I'm working with a radiology department in Nigeria, and one of the big complaints they had was the hospital is just backed up because these notes have to go out. And they are not getting done quickly, then patients have to wait a lot longer. So if you have a system or whatever AI system that helps shrink the time they spend doing their work, it means that the patient that would have had to sit down for 3 or 4 hours, or sometimes come back in
the next day,
2 or 3 days.
It happens all the time.
So that person gets their diagnosis faster, and then they're able to get care faster. Because and there are certain conditions that are time sensitive, and if you wait too long, it's already like progress. So that's like the real, not just the operational, but just the real patient value. Second thing is that now, because we're processing voice, we're able to real life, like real time, while the conversation is going, we're able to prompt the doctor to say, hey, this person said XYZ. Can you ask about fever? Can you ask about night sweats and all that? Yeah. And
so it gives you suggestions. And
so that's
wonderful.
That's pretty cool, because there's some things that just human beings are human beings. They're just maybe you're saying your 31st or 35th patient and all that. And so
you're tired, it's after lunch, you just had a nice jollof rice meal, you're like, you forget to ask certain questions.
So you're like, people are, okay, you just go. And the AI says, hey, check, this person is from this part of the country. Maybe they have an exposure to this, check that, ask this, ask that. Or you're done with the visa and it gives you options of diagnosis, like based on the conversation we just heard, these are the top 5 things you should be thinking about. And you're like, I wasn't thinking about this. Let me go check this, or let me go order this lab. So it helps you identify, it helps you be a better doctor, basically.
Dr. Tobi, beside it being an health tool, at the heart of it, it's an AI tool. Now, these AI tools aren't cheap. What is your business model? How is this sustainable, one? Okay, let's start with that before I go to the second one. How is this sustainable?
So primarily, we're a business, unlike many other AI things that are like researchy or like PhD-ish. We're a business and we need to make money. So we charge hospitals.
So there's a subscription.
Yes. Gotcha. So we charge per hour. So the longer you record audio, the longer we have to process, and that's how we charge them.
And is there different subscription for like an institutional, let's say a hospital that's got 3, 4, 4 or 5 hospitals in the country, and then is it different from as a standalone practitioner. I've got my own little practice in
correct.
Lagos there, and then
Correct.
Okay,
Yeah.
okay.
So because I mean, volumes are different. Like
Okay.
if you're working with a huge health system like we have in Nigeria and in Uganda, where they have like hundreds of doctors, of course you want to give them better rates. Absolutely.
Okay. And then initially, were you bootstrapping? Have you raised money? Are you looking to raise money?
Yep, we actually did a raise, our first raise in 2023. We announced it in 2024. It was 1.6 million USD.
Dollars, okay.
We've almost gone through that
You've
money
burnt that.
right now. Almost. So we're actually starting a new round. Actually, we opened up the round this month.
Okay. Beautiful.
And so we're raising again. But at least people can see what we've built with the money that we spent.
Yes.
They can see the technology and where the voice. The cool thing about the voice technology we've built is that it's not just for hospitals, it's not just for healthcare actually. So call centers, even healthcare call centers, you're a telehealth or a call center, you have so many calls, you don't have enough time to write notes or you...
100%.
Yeah, so there's just multiple use cases for it. And so that helps us expand the commercial case.
Dr. Tobi, I want to tap into the entrepreneur aspect. You're a doctor turned entrepreneur. The entrepreneurship part of it, when creating a solution such as Intron Health, this AI tool such as Intron Health, what aspects should other founders, other aspiring engineers and startups should be looking at? How do they get the balance between the use case and it getting traction on the ground? Because that's essentially what investors are looking for.
Yep. So I think I was actually talking to someone today, and I think one key thing is just two things. Number one, you need to identify a problem that's important. Okay. Not just not just the impact, but the scale. It's a large problem. Okay. Something like, let's say, cancers or malaria. It's a big problem. It impacts people, millions of people.
TB,
So,
TB is huge.
So there's big problems like that. There are small problems, but there are also big problems. So if you have to choose, pick a big problem, number one. Number two, you need to figure out who can pay for that solution. Because sometimes the patients cannot pay, sometimes the hospitals cannot pay, sometimes it's the government or a funder, or sometimes it's the patient. So you need to think about
who the client is. Who's paying for the service.
Yeah, because the user might be different, but is there someone in the value chain where this provides? So because I know that some people use the model of the pharmaceutical companies, maybe whatever outputs you're doing, they're able to share some insights with the pharmaceutical or the biotech guys, and those guys pay them. So you need to think about your solution in the context of the ecosystem and figure out, because your subscription may not work for some use cases and it may work, and just figure out like what's the easiest way to get paid for this. How much will people be willing? How much will a doctor pay for this solution? Because if a doctor can't afford it or won't pay for it, then who will pay for it? And so just figuring that out helps you come up with at least a fairly good model to start with, because someone can pay for it, and the problem is important, and someone can pay for it.
Dr. Tobi, you've raised 1.5 million. Congratulations. You're currently in the market looking for more money, but more money means more problems, more people. Talent is needed. What type of talent are you looking for? Are you hiring? Are you looking for people? Let my people know.
We're always hiring. We're always looking out for people who are special. And the reason is that you only know so much about the problems you have an idea of the problems you're facing, but then there's other problems that come up that you are not expecting. And so you want people who are creative, who have solved problems, and who don't run away from challenges. And so, yes, you have to have some functional skills, whether we're hiring you for HR or for AI or for engineering or for data and all that. You have to have some functional skills, but then just the grit. And so one thing we look for in people is, have you done something that shows that you're like a goer, you're like a doer? Because a lot of people talk a lot, they're taking some online course somewhere, they're doing blah, blah, blah.
100%.
But if we see that you've done stuff that's really cool,
Is your talent pool from Africa, or like your talent pool? How I'm trying to understand. Is it mostly from people back home here and on the continent, or is it a combination of global skills and local skills?
So for us, it has to be both, because we're working in a language space, so speech, text, and so you have to
Get local.
understand something.
Got
I mean,
you.
you can't speak like whatever. I mean, so we have to have a subset of the team that's local, and then of course we definitely want to bring experience, expertise from people who work outside, and so we sort of like do that mix.
But that outside experience that you're exporting, what is that skill? What is that? Is that engineering? Is that the software? What is that?
So most times it is research.
Okay.
It's the algorithms, it's the models. Even engineering is not as popular. Engineering for AI, there isn't as much experience because I mean our team is mostly homegrown, but that's because I have experience like doing this before. But yeah, there's research is the key thing. Actually, one problem where we had to bring in outside knowledge was hardware. So figuring out how do we get affordable hardware that can work,
that can record and actually.
Yeah, so not just recording, internet, power. How do we design a system that is cheap enough to go into a clinic and they have a device, they have backup power, they have connectivity. What are the options out there, and how can we design something that's really cheap, low power? Because if they're running on like solar or something, you don't want something that's just going to draw all their power. And so so figuring out all those things, there's multiple things that we need external like expertise for. But yeah,
you know, Dr. Tobi, the reason why I'm asking you this is because it's important for our brothers and sisters at home watching to understand. I mean, you're a company that is 6 countries. And you're looking to raise more money, you've raised money, and you're looking to scale. And our brothers and sisters back home need to understand what areas of this AI industry, this AI space, is where the vacuums are. So they can become more attractable in terms of the labor market. Because I'm a big believer that we should be eventually where we want ourselves is to have the talent locally. So you don't have to export. I mean, if you can get Brothers Fiso to do the same thing that Mark in London is doing, and he's here, he understands the language, he understands the colors, the rhythm down here, why not? And it's important for our brothers and sisters back home to know that, to be aware that, okay, this is what the companies are looking for, that, and let's focus on here.
2 things. I said before, do stuff. There's too many people that talk. Even
show us.
No matter how simple, how small your experience, your expertise is, be doing stuff, like do projects, do work for free, do projects, because when you do something, you learn, and then people can evaluate your trajectory based on what you've done. They can say, if you're able to do this with the little resources you had, it means if you give this lady, this guy resources, they can do much more. So that's one thing. Number 2, math. A lot of people in AI,
mathematics,
they think that there's a way to work around it or just do some
shortcut.
So if you really want to be like high value, you have to understand
mathematics.
I mean, I interview every time, and you ask about some AI model, and then you ask them, how does this work? And they're like, oh, I don't know. I just use the library. I just download it. I'm like, nah. You can do there's some tasks you can do with that level of knowledge. That's fine. But if you want to go far, you have to go deeper and deeper and deeper. And it takes time. It takes years. It took me a lot of time. I was able to work while I was doing it because there was jobs I could do. But as you said, look at where you want to go and the knowledge you need. You need to keep gaining knowledge, learning the underlying math, the algorithms. And then, I mean, with time, you will see yourself getting to the point where you can actually do big things.
Dr. Tobi, I'm happy you talked about the mathematics situation, because that is a fight we're actually fighting in a lot of countries. And it's important for our brothers and sisters to know that mathematics is a very essential key to a lot of professions. So let's stop taking math literacy. Please, guys. Let's take mathematics. Hey, this thing of math literacy. Counting eggs plus minus 4 equals how much? Please, Dr. Tobi, thank you so much. Thank you so much. The work that you're doing is wonderful. We're looking forward. We're cheering you on. We're looking forward to the news of you raising more money. We want to see you in more countries.
Absolutely.
Thank you.
Thank you very much for your time.